So, what is a total hip replacement? Going back to our anatomy of the hip, total hip replacement is a replacement of the socket, the acetabulum on one side, and the ball of the hip, the femoral head on the other side, with a femoral component, which we'll show. And these are the components of a total hip replacement. So you have the cup, the acetabular shell, and that gets impacted or embedded into the patient's natural cup after it's been prepared with the computer-assisted navigation. And that's the component that we want to have bony ingrowth. The polyethylene insert, the plastic, gets snapped into the cup. And then on the other side, the femur is prepared in a special way, again with computer-assisted navigation. And the femoral component, the femoral stem, is what gets inserted into the canal of the thigh bone, the femur. And then the femoral head gets placed on top of that. So you're still with a ball and socket joint. You may hear the term a bipolar or a partial hip replacement. If you're doing a hip replacement for arthritis, there's almost no circumstance in that you're going to do a partial hip replacement. A partial hip replacement is something that is used for fractures. Typically, hip fractures occur in the elderly. If they do not have pre-existing arthritis, the most common treatment for a particular type of hip fracture is to do a partial hip replacement, replacing the ball of the hip and leaving the patient's native cup acetabulum the way it is. So the total hip replacement is primarily used for the arthritis condition. MIS, minimally invasive surgical technique, is performed on a regular basis nowadays with surgeons who have been trained with the technique, and the instrumentation is what has made it possible to be able to do a hip and knee replacement through a smaller incision. Again, the more important aspect of it is not the length of the skin incision, which is basically cosmetic. It's the amount of soft tissue surgery, soft tissue dissection of the muscles below the skin that we feel is of the most benefit. I point out that the same implants are going in. It's not that there's a smaller implant or a different implant when MIS, minimally invasive surgical technique, is utilized.